The first 50 years of Fenway Health were so full of incredible accomplishments and historic milestones that we can't possibly name them all during our short time together tonight. We've selected a few of the brightest highlights from our first 50 years. We hope you enjoy this journey through Fenway Health history.
The 1970s is where it all began. 1971, founded by Fenway neighborhood residents and community health advocates, Fenway Community Health Center opens its doors as a one-day-a-week drop-in center staffed by volunteer medical students. The center is dedicated to serving the diverse Fenway neighborhood.
1976. Fenway conducts anonymous STD testing at gay bathhouses in Boston as part of a joint effort with DPH to reduce the spread of STDs and hepatitis.
In 1978, Fenway applies to become fully licensed by the Massachusetts Department of Public Health.
The 1980s, a decade of firsts. 1981, Fenway makes the first diagnosis of AIDS in New England.
1983, the AIDS Action Committee is founded as a committee of the Fenway Community Health Center to respond to the epidemic. AIDS Action remains the largest AIDS service organization in New England.
1985, the first baby is born from Fenway's alternative insemination program. Our AI program was one of the first in the nation to offer these services to lesbians.
1989, Fenway's Violence Recovery Program is established, as well as the Gay and Lesbian Helpline.
The 1990s, building community. 1992, Fenway throws its first annual dinner party, a fundraiser for Fenway's Women's Health that will become one of the largest LGBTQIA+ events in the nation. 1994, Fenway is selected as one of 8 sites and the only community-based health center to recruit patients for the nation's first HIV vaccine trials. 1999, Fenway holds the first annual Audre Lorde Cancer Awareness Brunch, a celebration of women of color and their supporters whose lives have been affected by cancer. The 2000s, breaking new ground. 2001, Fenway launches the Fenway Institute, a national interdisciplinary center dedicated to ensuring cultural competence in healthcare for the LGBTQIA+ community through research and evaluation, training and education, and policy and advocacy. Dr. Kenneth Mayer and Dr. Judith Bradford are named co-chairs of the Fenway Institute. 2003. The Fenway Men's Event draws a record 1,500 attendees and sold out for the first time. More than $250,000 was raised to help support Fenway's programs and services.
2004, Fenway launches the Trans Health Program to help provide care to this often underserved population. Now serving more than 4,400 trans and gender diverse folks, the program continues to expand to provide comprehensive care to these communities.
2009. On March 30th, the doors open on Fenway's new 1340 Boylston Street home. The 10-story, 100,000 square foot facility is the largest building ever constructed by an organization with a specific mission to serve the LGBTQIA+ community. The new facility allows Fenway to expand its medical and behavioral health departments and pharmacy, and to add family dentistry and eye care services.
The 2010s, a growing Fenway family. 2010, the Sidney Borum Jr. Health Center joins Fenway Health. The Borum's mission is to serve marginalized and disenfranchised young people, including those who are LGBTQIA+, homeless or street-involved, or living with HIV or AIDS.
2013, the LGBT Aging Project, which supports and advocates for LGBTQIA+ older adults, becomes part of the Fenway Institute.
In 2013 also, AIDS Action becomes part of the Fenway family once again, expanding care and services to people living with HIV/AIDS and strengthening advocacy, prevention, and research efforts.
2015, Fenway's National LGBT Health Education Center holds a first-of-its-kind conference focused on transgender health.
The 2020s, looking to the future. 2020, Fenway welcomes Ellen LaPointe as our new CEO.
2020, Fenway responds to the COVID-19 pandemic by moving the majority of medical and behavioral health appointments to telehealth, establishing testing programs in Boston and Everett, and activating several research studies, including COVID-19 vaccine trials.
2021. Fenway celebrates 50 years of community care.
There are so many more stories we could tell about Fenway from a half-century of community care. We're proud to carry this history in our hearts and in the work we do every day for our patients, clients, and the whole Fenway Health family. Here's to the next 50 years of the Fenway story.
Welcome to Fenway at 50. My name is Nina West, and I'm proud to be your host and MC for this evening's festivities, and I'm so glad that you're able to join us from wherever you are tonight as we celebrate 50 incredible years of Fenway Health. You know, a lot has happened in these past 50 years. Bostonians lived through the Big Dig. Massachusetts led the way to same-sex marriage by the first state to legalize it, and Tom Brady won 7 Super Bowl titles, although the last one was for the wrong team. Now, we have a great lineup of speakers and entertainers as part of tonight's show, and throughout the night, you're going to be learning about some of the life-changing work going on right here at Fenway Health right now. You'll meet the CEO of Fenway, Ellen LaPointe, and you're going to learn about her incredible vision for this organization and its future ahead. We also have some incredibly great musical numbers to help keep everyone energized along the way. And we also have some friends popping in to say hello, which is my favorite part. Hello. Hello. We're also thrilled to have as our keynote speaker someone who has changed the lives of all of us, the incredible Dr. Anthony Fauci. I can't wait to hear what he has to say. Now, you know, because of this pandemic, Fenway hasn't been able to hold their 2 big spring events for the last 2 years. The Fenway events are an important cornerstone of LGBTQIA+ social calendars right here in Boston. And we've all had to go 2 years without dressing up, seeing so many of our friends, and of course, dancing the night away. How many of you are missing the dance party right now? I know I am, but have no fear. DJ Mocha is here. That's right. DJ Mocha has created a special Spotify playlist for tonight's event. You can go to the link in the chat room right now, download it, and after our event is over tonight, have your very own socially distanced, fabulous dance party. I know that's where my after party is going to be. Now, because events have been on hold, Fenway has had to turn to additional ways to raise money to help support Fenway's work and its mission. And tonight, that's no exception. And this is where you come in at home. There are so many ways that you can help support the work of Fenway Health. You can make a gift online using the link in our chat room, or you can make a gift right now. You can make it when the show's over, you can make it tomorrow, or you can make it the next day. But you should do it right now while you're thinking about it, and while this drag queen is looking at you. That's right, click the link in the bio. There's incredible things happening right now, including a live auction. Yes, that live auction has been going on for a couple weeks, but bidding is still happening, and there's still time to find that perfect item just for you. And remember, it goes to an incredible cause. Hey, Fenway! So, there's beautiful artwork to bid on. There is a trip to Provincetown. There's even a signed baseball from Red Sox superstar Rafael Devers. So, hit up the auction, bid early, and bid often. And again, the link for the auction is right there in the chat. So on behalf of everyone here at Fenway, I say thank you. Thank you for joining us tonight, and thank you for your continued support. So let's get the show started. One of the most important legacies of Fenway's history is its commitment to the transgender community. Let's take a moment to learn more about some of the important work being done right now at Fenway Health.
It is essential for trans and gender diverse people to have access to the best quality care possible. Fenway has such a high bar that we have set. One of the things that the Trans Health Program does is figure out, does someone know where to put their name, where to put what pronouns they use? How can we make sure that our patients and clients are having the best experiences possible when engaging in our care?
As a trans person, I've had such a positive personal experience throughout my transition, and I think it's so important to pay that forward and create space for people to be able to tell their stories. Research in and of itself is an important form of advocacy because without data, without information, you don't really know what the community needs. With the Legacy Project, we are actually able to look at a lot of our own patient data.
The earliest records that we have of our patients at Fenway having trans or gender diverse identities is starting in 1997. Right now, we have just under 6,800 patients with active electronic health records.
Never before have we had such a large cohort of patients to actually look and see, what's going on in the population and what are some of the kind of unique health factors. The cervical cancer screening for transmasculine individuals. So that is a big study that we did exclusively at Fenway, being able to do a swab yourself in the comfort of your own home. We were able to show that it detected 7 out of 10 cases when compared to a cervical pap test. And so we always say that we're not doing research on the community, we're doing research with the community, always engaging folks from the very beginning and always in the end, making sure that the results of our research end up back with the community in a way that benefits them.
One of the things that we focus on a lot is making sure that that information is accessible as possible. One example of content that we've produced more recently within the past year or so is around how to safely bind one's chest to create a flatter appearance of the chest. There's not a ton of research about that. We made a brochure. We made sure that we have as many openly sourced and available materials and information as possible so that trans and gender diverse folks anywhere can get the care that they need.
Good evening. I'm Jonathan Matsui, Chair of Fenway Health's Board of Directors. On behalf of my colleagues on the board, I'd like to thank all of you for your ongoing support of Fenway Health and for joining us to help celebrate 50 incredible years of caring for our community. There are a lot of ways to help support the work of Fenway. You can volunteer for a research study at the Fenway Institute and help us guide the future of LGBTQIA+ health. You can choose Fenway Health for your medical, dental, behavioral health, or eye care by becoming a patient. You can tell your family and friends about our work and encourage them to get involved. And you can make a gift to help support Fenway financially. You can do that tonight as part of our Golden Anniversary celebration, or at any time during the year. Your gifts help us to expand access to care and help fulfill our promise that no one will ever be denied care because they can't afford it. And speaking of support, I'd like to take a moment and recognize our gold-level corporate sponsors and their ongoing commitment to our work. Please join me in thanking Boston University, Biogen, Consumer Medical, Eastern Bank, Karyopharm Therapeutics, Moderna, PwC, and Santander Bank. Now it is my pleasure to introduce the CEO of Fenway Health, Ellen LaPointe. Ellen joined us just over a year ago, right as the COVID pandemic was spreading across the country. In her first few weeks on the job, she had to build a plan to keep the organization operational during the statewide lockdown. This included having most staff transition to working from home and the cancellation of several of our important community events. That's quite a way to start a new position, and Ellen did a fantastic job by keeping the focus on her response to the virus and caring for our community. If you are not familiar with Ellen's background, over the past 3 decades, she has held numerous leadership roles in the nonprofit and public health sectors, working in social justice, research, LGBTQIA+, and HIV activism and advocacy, health policy, law, and equity. Ellen also has strong ties to our area. She is a native of Maine and began her career as coordinator of the Brown University AIDS program after earning her bachelor's degree from Brown. She later earned a law degree from UC Berkeley and spent several decades working in the Bay Area before returning home to New England and joining us at Fenway Health. And we couldn't be happier to have her leading our organization. Please welcome Ellen LaPointe.
Thank you, Jonathan, for that generous introduction. And thank you to our platinum sponsors, Beth Israel Lahey Health, and Takeda Pharmaceuticals, who make so much of our work possible with their incredibly generous support. But most of all, I want to thank you, the Fenway Health community that has built this organization over the last 50 years. We're celebrating our golden anniversary tonight, thanks to the vision and the audacity of Fenway Health's founders, volunteer clinicians, and community members who passionately believe that healthcare is a right, not a privilege. We're here because Fenway's founders matched their vision with a determination to do whatever it took, day after day, to bring that vision to life. In the very early days, that meant running a drop-in center on Thursday nights in the basement of a building owned by the Christian Science Church on Huntington Avenue. The office was furnished with chairs, tables, and medical equipment donated by a retired Back Bay doctor. Today, that means providing outstanding care to more than 34,000 patients in 38 states, and recognition from HRSA that we are one of just 36 community health centers in the country that exceed national clinical quality benchmarks for chronic disease management and preventative care. Whether you're a patient, a member of our staff or board, a volunteer, or a donor at Fenway Health, you are not just a part of this 50-year history, you are making history. In response to the COVID-19 public health emergency, our staff dramatically adjusted Fenway's operations, launching a new telehealth program. Our volunteers called LGBTQIA+ seniors to see if they needed grocery runs or prescriptions picked up. Our supporters generously backed these efforts, ensuring that we had what we needed to continue offering care and services to the people who count on us. We launched a free COVID-19 testing site in Boston for our patients and a second one in Everett, open by appointment to anyone. We worked with the state's Community Tracing Collaborative to help with COVID-19 infection contact tracing. Our team brought multilingual Spanish, Vietnamese, and Portuguese capacity, as well as experience working with LGBTQIA+ communities to that effort. And as you will see in a video later in our program, our scientists and researchers are playing a key role in the global fight against COVID-19. This past year has affirmed that Fenway Health is nimble, resilient, resourceful, creative, and innovative. It's also taught us 3 key lessons that will guide us over our next year and the many more that will follow. The first lesson is there is no going back. The COVID-19 pandemic laid bare the disparities in healthcare and health that occur based on race. Fenway Health has committed to becoming an anti-racist organization by working to overcome the disparities and inequities that exist in the services we provide, the people we reach, and the outcomes we achieve. We're committed to cultivating organizational leadership that is representative of the communities we serve. We have already announced recent appointments and are proud that we are adding racial, gender, and gender identity diversity to our leadership team. The second lesson is that our voice matters. Advocacy is core to our work, and our voice matters when public policies impacting the people, families, and communities who count on us are being advanced. Throughout 2020, we submitted public comment and testimony and joined coalitions in partnership with other institutions to advance and disseminate LGBTQIA+ and HIV-related health policy research. In July, we joined a broad coalition of healthcare providers, LGBTQIA+ advocacy groups, and patients as a plaintiff in a lawsuit challenging a decision by the U.S. Department of Health and Human Services to eliminate the protections against the sexual orientation and gender identity discrimination in healthcare that were put in place by the Affordable Care Act. And the third lesson, the past is prologue and our future is bright. As we look back, we might wonder if our most visionary achievements, like starting a healthcare center from scratch, are behind us. I can assure you that they are not. Time and time again, throughout my first year with this remarkable organization, I have been humbled and astonished as I've watched our healthcare providers, scientists, researchers, and community advocates rise to meet the moment with expertise, compassion, and grace. It has been difficult, and the demands placed on each of us have been relentless. It's no secret that the battle against COVID-19 has taken a toll on healthcare workers, and Fenway Health is no exception. We've suffered loss, and we've been drained by the constraints under which we've had to live. but we have persevered. As we mark a year in our collective experience with this public health crisis and our 50th as an organization dedicated to ensuring that everyone has access to the highest quality healthcare, I really want to express my heartfelt gratitude and enormous pride to all of you who are part of the Fenway Health community. We can draw a bright and beautiful line from everyone here tonight to the folks who founded Fenway Health 50 years ago. We have proven over and over again that when a community comes together, anything is possible. That remains as true today as it was then. We are working hard to leverage the extraordinary legacy of our past and the passion and capacity we have today to become the Fenway Health of tomorrow. This is a night for all of us. Thank you, thank you, thank you for being a part of this community, of our legacy, and of the bright future we will make together.
Thank you so much, Ellen. I'm absolutely amazed at how much Ellen has been able to accomplish this past year, especially in the midst of a global pandemic. And I can't wait to see what the future has in store for our beloved Fenway Health. Now, throughout the past 5 decades of groundbreaking work, Fenway Health has always relied on the generosity of community members, folks like you, to support the mission to care for everyone who walks through those doors, regardless of financial ability. It was true when Fenway first saw its patient in 1971, and it's true today as Fenway navigates the challenges of COVID-19. And it will always be true as Fenway embarks on the next 50 years of service. That's why we're asking you at home right now to make a gift to help support the work of Fenway Health. You know, your financial support is integral, and it will help offer life-saving care and services to Fenway's 34,000 patients and clients. It will help continue to provide leading-edge education and training. Your donation will help conduct world-changing research. And know that your gift tonight will continue to help Fenway engage in fierce advocacy on behalf of people who count on Fenway Health every single day. Every gift is so critical to helping Fenway stay true to its mission. So whether you can give $5 or $5,000, please help honor Fenway's extraordinary 50-year legacy and set the stage for the critically important work that lies ahead. Now, see the link in the chat and make your gift of support to Fenway right now. Yeah, right now. Click on it. Don't be afraid. I'll still be here. Just click on the link. Click. Just hit click. Yeah, that's right. $5,000 to $5,000. The work is up to us. Now, it's time for a little music. What do you say? I am thrilled to welcome a Bostonian. Mel Fine is a neon-haired, non-binary, storytelling 20-year-old singer-songwriter who is a multi-instrumentalist, infusing soulful vibes with folky acoustic pop to create music that sucks you in and takes you on a journey, with their lush vocals to hold your attention to the very end. And, of course, they are a perfect addition to tonight's program. Please welcome Mel Fine.
Hi everyone, I'm so excited to be here at the Fenway Health Gala. My name is Mel Fine and I'm a 20-year-old singer-songwriter from Berklee College of Music. I'm about to play you all a song that I wrote about my experience growing up non-binary and not feeling like I fit into either box regarding gender. So, without further ado, here's my new song, In Between. Your boutonniere sits on the table. Dad buttons your sleeves. Mama fixes your makeup. They don't know you're not their little prom queen. Stare into the mirror. Breathe reality in. Maybe this is the moment you'll find comfort in your own skin. It's time to tell yourself the truth about why dress shoes feel this good on you. You're in between the men you look the person you know that you are meant to be. Finally, 'cause it feels just right when you wear that suit and tie. Halloween, you dressed up as a pirate when all your friends were in pink. Dreamed of cutting your hair short, sweeping pretty girls off their feet. It's time to tell the world the truth about why dresses don't feel good on you. You're in between the men you look up to and the woman they said you would turn out to be. And now you see you're in between the question and answer, the person you know that you are meant to be. Finally, 'cause it feels just right when you wear that suit. You're not stuck in one of two sides. Be your own design. You're in between the man you look up to and the woman they said you would turn out to be. And now you see you're everything. The question and answer, the person you know that you are meant to be. Finally, 'cause it feels just right when you wear that suit and tie. Oh, 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 oh. It feels just right when you wear that suit and tie. Thank you again, and I hope you're all staying safe and healthy.
Hello, Fenway Health. I just wanted to thank you for all that you have done to help others over the last 5 decades. Your work to serve everyone, regardless of ability to pay, is so important, especially now. Healthcare is a right, not a privilege, so keep doing that incredible work. Thank you so much.
I started working an evening a week in July 1980. Within a year after that, what came to be known as the AIDS epidemic hit, and Fenway really was ground zero for the community response to the early epidemic in Boston. You know, initially there wasn't a lot of attention to the emerging AIDS epidemic in the Reagan administration, but eventually the National Institutes of Health did get funding, and we were one of the first sites in the country to start recruiting people for HIV vaccine trials. That initial work in HIV/AIDS has expanded over the years, and it really prepared us to deal with the COVID-19 pandemic incredibly well. Fenway is one of about 4 sites in Boston now that's funded by the NIH to do HIV research. And at the end of March 2020, Dr. Fauci said to the leadership of all these networks, we have this great infrastructure for doing clinical trials. Now, the most important thing as a society we need to do is show that COVID-19 vaccines are safe and effective. So you sites are essentially going to be doing the COVID vaccine trials. The staff were totally motivated and worked brilliantly in terms of trying to figure out ways to educate the community, engage the community, and educate providers.
During COVID-19, we had a greater opportunity to understand how to access folks during a time where we weren't interacting with each other physically. We really learned about all the different ways to reach people. Text messaging for folks who've been on Zoom or who've been on the phone and they want to be reached in different ways. Folks that might need a letter actually sent. Folks that do need a phone call. Evolving through a very ever-changing time has given us the opportunity to reach people and spaces that we hadn't before. Black and Indigenous people of color are greatly underrepresented in research in general. And so using our COVID-19 vaccine trial as an example, we wanted to be clear about how we're investing in the community. We are working together to understand how to better serve the Black community in Boston. We're really excited by that, really energized by that. Every day we learn about different things that we can do to connect closely to people and allow them to feel independent and have autonomy and agency over their health and what they participate in and how they contribute to our work.
The great thing about Fenway is that we can go from concept to actual implementation that can have an impact on the life of the community. We keep striving to do better and trying to expand and trying to be more responsive to the diversity of the communities that we serve.
Good evening, and thanks for joining us for the special celebration of 50 years of Fenway Health. I'm Ken Mayer, co-chair of the Fenway Institute. I have the pleasure of introducing tonight's keynote speaker, a longtime colleague and friend, Dr. Anthony Fauci. Most of us know Dr. Fauci as an American physician scientist and immunologist who serves as the director of the U.S. National Institute of Allergy and Infectious Diseases, also known as NIAID, and the chief medical advisor to the president. As a physician with the National Institutes of Health, Dr. Fauci has served American public health in various capacities for more than 50 years and has been an advisor to every U.S. president since Ronald Reagan. He is probably the most visible and trusted face of the COVID-19 pandemic and is on television almost every day to help educate and comfort the nation. His knowledge, clarity, frankness have made him the go-to source for information on social distancing, testing, and vaccines. But what you may not know is that Fenway Health has had a long and productive relationship with both NIAID and Dr. Fauci. I first met Dr. Fauci in the mid-1980s when I served as the primary scribe for an external advisory panel that reviewed NIAID's early AIDS research activities for the NIH director. I was exceedingly impressed with him from the get-go in terms of his scientific acumen and commitment to public health. My respect for him grew immensely several years later when he was challenged by ACT UP to expedite research into promising treatments for AIDS. Many of his colleagues became defensive and avoided engagement, but Dr. Fauci realized that people were literally fighting for their lives. So he developed a productive dialogue with activist leaders like Larry Kramer, who subsequently became his friends. Fenway Health has been fortunate to receive funding from NIAID for more than 25 years, helping us to become a leader in HIV vaccine trials and a key player in the domestic HIV prevention network. And NIAID has supported Fenway Health to be one of only 2 U.S. sites for the IPREX trial, which was the first study to demonstrate the efficacy of tenofovir emtricitabine for pre-exposure prophylaxis. This led to what most of us today refer to as PrEP, one of the biggest game changers in the fight against HIV that we've seen. NIAID funding for Fenway continues to this day and allows us to conduct HIV prevention trials. Dr. Fauci's support and leadership have helped Fenway Health care for our community over the past 35 plus years. I can't say enough about what Dr. Fauci has meant to our work and how much he has meant to Fenway Health. Please welcome our keynote speaker for our Fenway at 50 anniversary event, our dear colleague, Dr. Anthony Fauci.
Warm greetings, Fenway Health, and happy 50th anniversary. My name is Tony Fauci, Director of the National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to President Biden. It is my great pleasure to join in this celebration of your community health center, a treasured New England-based healthcare provider and research partner to my institute since the earliest days of the HIV pandemic. For decades, the person ensuring Fenway's outstanding track record in research on HIV/AIDS has been your medical research director, Dr. Ken Mayer. I first met Ken in the mid-1980s when he served on an external advisory panel to the NIH director to review NIAID's early research response to AIDS. Quite simply, Ken is the whole package. Visionary leader, pioneering research scientist, and compassionate physician, dedicated to enhancing the well-being of the LGBTQIA+ and wider community. Thank you, Ken, for your extraordinary contributions. Throughout the HIV epidemic, Fenway has played a vital role in caring for people with HIV as well as in advancing HIV treatment and prevention options. Your HIV/AIDS research history began in 1981 when Fenway documented the first case of AIDS in New England. Subsequently, both the AIDS Action Committee and the Community Research Initiative of New England were formed at Fenway. Just to cite a few highlights of our relationship, in 1994, NIAID funded Fenway to perform HIV prevention trials, and you conducted the first HIV vaccine trials in New England. In 2001, Fenway joined the NIAID HIV Prevention Trials Network as the only New England site, and you also collaborated with Harvard in the NIAID-funded HIV Vaccine Trials Network, enabling Fenway to participate in a broad array of vaccine and prevention research. Notably, Fenway was one of only 2 U.S. sites that participated in the first clinical trial demonstrating the efficacy of pre-exposure prophylaxis for HIV prevention. In addition to your stellar history in conducting community-based clinical research, Fenway is renowned as one of the most progressive research centers focused on advancing medical interventions, culturally tailored for sexual, gender, racial, and ethnic minority patients. I am immensely proud that Fenway Health and other community health centers has stepped up to be on the front lines addressing another pandemic, COVID-19. Just as community-based organizations transformed the U.S. response to the HIV pandemic, you have let the U.S. government tap your collective expertise in community engagement and community-based research to help rapidly mobilize and directly engage in the public health response to COVID-19, including pivotal vaccine trials. And so, congratulations again on your 50th anniversary, Fenway Health. My heartfelt gratitude for what you have accomplished with us in research and for your extraordinary efforts to better understand and enhance the well-being of all individuals. And thank you for walking with us in our current challenge to gain the upper hand over the COVID-19 pandemic. By pulling together, we can and will prevail.
This the one and only Big Fruit of the Queen Diva wants to say happy birthday, your 50th birthday to Fenway Health. You're always taking care of people, so take some time and take care of yourself. Much love and happy, happy birthday. You heard me, Fenway.
Throughout the 50-year history of Fenway Health, community events have always been a part of the effort to build support for the organization. Now, some of you may remember the Boston to New York AIDS rides of the 1990s, which raised millions of dollars to help Fenway care for HIV patients, especially during the darkest days of the AIDS crisis. Now, after the Boston to New York rides ended, local business person and former Fenway board chair Michael Ty created the Harbor to the Bay ride from Boston to Provincetown, where 100% of the money riders raised would go to support several beneficiaries of the ride. And after 19 years, Harbor to the Bay is still going strong. So if you're looking for more ways to support Fenway Health and AIDS Action, here's your chance. This year's event is scheduled for September 18th and will once again be Harbor to the Bay your way. Ride, walk, climb stairs, run, do jumping jacks, binge watch your favorite TV shows, but whatever you do, ask your family and friends to support you. You can sign up today at harbortothebay.org. Another great way to support the work of Fenway Health and AIDS Action is through the annual AIDS Walk Boston. For over 35 years, AIDS Walk and Run has united thousands of runners, walkers, and participants of all ages in support of Fenway Health and AIDS Action's essential programs and services. You can sign up now at aidswalkboston.org. And this year's event is on September 26th at a new location, Carson Beach in South Boston. Will you join? I think you should. And also, did you see those wild yellow and blue uniforms the Sox wore the other day? They were in support of the Boston Marathon, which this year will be held in October. Fenway Health is proud to have been awarded 3 charity bids for the 2021 Boston Marathon by the John Hancock Nonprofit Program. Fenway is seeking bib applicants who are committed to Fenway's mission with documented charity fundraising experience or comprehensive plan to meet the $7,500 fundraising goal, and of course, who love running. So if you're interested, please contact the Fenway Development Department. And of course, if you aren't a runner, you can make a gift to support Fenway runners right now. I don't know about you, but I am ready for some music. Our next performer is a singer, an actress, and an arts manager originally from Pretoria, South Africa. She graduated from the Berklee College of Music and has toured internationally with the University of Pretoria Youth Choir and has performed with Grammy Award-winning artists such as Esperanza Spalding and John Oates of the legendary Hall & Oates. She's been a featured vocalist with the Silver Arrow Band since 2017 and has performed at the Regatta Bar as part of the Berklee Summer in the City concert series. Please give a warm welcome to Neo Abo.
The sunshine through my shanty, it woke me up today. I had no food yesterday and none today. I could sit here grumbling about what's not right today. Instead, I close my eyes and thank God that I'm alive today. Leo, Niko hai nika huru. Leo, na uhai na shukuru. Leo, Niko hai nika huru. Leo, na uhai na shukuru. Living and loving and giving and having is where I am today. I am alive, so I can smile. I'm so glad today. I'm living and loving and giving and having is where I am today. I am alive, so I can smile. I'm so glad today. Somebody said I would not make it, but that was yesterday. And oh, how different that was then from what is today. The sun shines over the beach every night and day. I am alive, so I can smile. I'm so glad today. Leo, Niko hai nika huru. Leo, na uhai na shukuru. Leo, Niko hai nika huru. Leo, na uhai na shukuru. Living and loving and giving and having is where I am today. I am alive, so I can smile. I'm so glad today. I'm living and loving and giving and having is where I am today. I am alive, so I can smile. I'm so glad today. Rafiki yangu, usife moyo. Mola aona na Mola ajali. Shukuru kwa yale yote ulionayo. Simama wema, omba amili. Niko hai, niko huru. Na uhai na shukuru. Niko hai, niko huru. Na uhai na shukuru. Living and loving and giving and having is where I am today. I am alive, so I can smile. I'm so glad today. I'm living and loving and giving and having is where I am today. I am alive, so I can smile. I'm so glad today.
Thank you, Neo. That was spectacular. Now, throughout the long history of Fenway Health Spring events, silent auctions have always been some of the more popular attractions each and every year. But since we're not meeting in person, Fenway can't have the usual silent auction, but we've got the next best thing. We have a fabulous online auction, and it's happening right now. Now, there's a fantastic full array of items up for bids in this online auction. Yes, the room is popping, and it needs you to be there. You can find the link for the auction in the chat room. Here's an incredible list of some awesome items. Listen to this. You can bid on a 1-week getaway to a beautiful private residence in Provincetown. Isn't everyone ready to get back to Provincetown? I know I am. Or you could also bid on a priceless Judith Ripka necklace. What about a signed baseball from Red Sox superstar Rafael Devers? Or even a wide variety of inspiring, stunning, original artwork. And if you're interested in starting a family, we even have a gift certificate from California Cryobank. There's something for everyone. And remember, all of your money tonight is going to Fenway Health. The auction closes tomorrow night. It's April 29th, Thursday, April 29th at 9 p.m. Eastern Standard Time. So you don't have much time left, and you better hop on right after the show and bid on all of the things. Follow the link to the auction on screen for more information. Thank you again for bidding to all of our bidders, and if you haven't bid yet, consider doing it now. What a great way to get something in return for making a gift to Fenway Health. Now, you know, some of the most important people in our community are our children. We can all remember what it was like to be a teenager trying to find our way in the world. It's not easy. Many of us grew up without the support networks or the role models we so desperately needed. I mean, how did any of us survive without RuPaul's Drag Race? I'm just kidding. But fortunately, we do have role models like Fenway Health, and they're providing amazing services for our young people. Let's take a look.
At Youth on Fire, we work with folks who are 14 to 24. I would say the average age is 21 or 22. There are a lot of reasons why a young person could find themselves experiencing homelessness. For some people, their family may have lived in shelters before. A lot of the times people are running because home isn't safe or supportive. If you're newly homeless, you're particularly vulnerable to folks that might take advantage of you. It's like daily survival every single day. And there's a lot of trauma that comes with that. 35 to 40% of the young folks we see identify as something other than heterosexual. They literally can come to our door, ring the doorbell. Hey, can I help you? Someone will go up to greet them. So we'll ask people, how do you want to be identified? And what pronouns do you use? How do you want to be referred by? Sometimes someone's coming out for the first time. And then one of us will show them around. So let them know, this is how you get a plate of food. If you need things for a shower, let us know. We've got towels. We want to make people comfortable more than anything. And this is a place where there are safe, supportive adults who can help them on their goals. For a lot of folks, that might be looking for a shelter for the night. We've helped people get their stimulus checks. For other people, they might want a medical appointment, an HIV test or an STI test. Then we're the ones linking them to care. We're the ones calling other folks. We have a really great sexual health team at Fenway.
Youth on Fire refer them to us. So we came up with a same-day approach that you call us, we'll see you. We support those adolescents that have the hardest time, so substance abuse, psychiatric disorders, trans, HIV, people of color, and LGBTQ. We see around 3,000 plus new patients a year. The proportion of our patients who are trans-identified has gone up, and at the same time, that population has become much younger. Our patients are at that inflection point. They're trying to figure out, I'm on the street now, am I going to be on the street all my life? How do I move forward? Our goal is to be consistently available to them so that they know what they can count on, what they can get. There's a multitude of little things throughout the patient's experience which add up to respect and an appreciation of them as a human, which they feel, which they may not get in other places. We try not to say, this is our HIV patient, because that implies somehow that that's their identity. We say, this is X, he's the patient who was diagnosed with HIV. You build up that respect in all of these little ways, piece by piece, over time, every day and every time you see them. And continuing that approach to care and being able to expand that is an essential aspect of maintaining connection to that population.
what incredible, remarkable work that is being done by the Borum and Youth on Fire. Folks, if you have not made a gift yet tonight, now's your chance. Please do so right now and do it in honor of our kids. Let's help make sure that the next generation has the support and the services they need not only to survive, but to thrive. We hope that as we wrap up tonight's celebration of 50 years of Fenway Health, you've enjoyed yourself. I've had a wonderful time, and it's been such an honor and privilege serving as your host and MC tonight, and I really am so happy that all of you could be with us, even virtually. Don't forget, there's still time to visit our online auction and bid on your favorite items. I personally would love to go to Provincetown. The auction will close at 9 p.m. Eastern Standard Time tomorrow, so you've got just a little bit more time left. And it's the time to sign up. Whether it be Harbor to the Bay or AIDS Walk Boston or both, we could use your help there too. There's still a lot of time to get into riding shape for September. Remind me to put down the pizza and come join you. And please, 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 please make a gift tonight to help support the work of Fenway Health. Let's kick off the next 50 years by raising a record amount of money tonight for the good of Greater Boston. I also want to take this opportunity to thank our keynote speaker, Dr. Anthony Fauci, for spending time with us tonight. I know I speak on behalf of all of us who say that we have been in and will continue to be in good hands thanks to Dr. Fauci's leadership. And I know we can all see a light at the end of this long tunnel thanks to Dr. Fauci. I'd also like to thank our speakers and our special guests, our entertainers, and everyone who made tonight happen. It would not have been possible without you. But most of all, tonight could not be possible without each and every one of you at home, spending this hour with us and for your ongoing commitment and support of Fenway Health and its remarkable mission. You are what make this all possible. So thank you. Now, I know that we started off the evening with a look back at our 50-year history of Fenway Health, presented by some of the incredibly dedicated staff right here at Fenway. So it seems the only perfect way to close the evening would be to feature some more of the Fenway Health staff. Our final musical performance of the evening will be the Fenway Health staff chorus, the F Chords, bringing you their version of a song that I'm sure you're pretty much familiar with. Yeah, I said you're pretty much familiar with it, so you better be familiar with it. Sing along wherever you might be. And remember to support Fenway Health. Have a wonderful evening, everyone. Thank you for coming tonight, and we hope to see you in person at the Marriott Copley Place in 2022. And now, the pretty fantastic, the pretty remarkable, the F Chords.
I've learned to be ashamed of all my scars. Run away, they say. No one will love you as you are.
Won't let them break me down to dust. I know that there's a place for us. Warriors.
When the sharpest words wanna cut me down,
Sharpest words wanna cut me down.
gonna send a flood, gonna drown a
I am brave, I am bruised, I am who I'm meant to be. This is me. Here we come. Look out, 'cause here we come. We're marching on. Fenway Health, and we're marching on. We're not scared. We know OG. This is we for the glorious. Doom, 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 when the time has come to mark 50 years. For founder staff and our volunteers. For founder staff and our volunteers. Of what's been and of what we all will be. This is we. Here we come. Look out, 'cause here we come. We're marching on. Fenway Health, and we're marching on. AAC, healthcare advocacy. This is we. Don't show our